Hello, everyone. Thank you for joining us today for our fourth annual Public Policy Summit, presented by the American Association of Kidney Patients. My name is Richard Knight, and I have the pleasure and honor of serving as the president of AAKP. The mission of AAKP is to educate and advocate, where we bring patients to the table for important discussions about health, promoting community, and AAKP always is inclusive of minority and underserved populations. AAKP's foundation is in fact steeped in advocacy. It was in 1969 we were founded by 6 dialysis patients who came together in support of one another and to provide a resource for others dealing with kidney issues. We have been involved in legislation and regulatory issues impacting kidney patients since day one, and we continue to do so today. It was in 2015, Paul Conway, past president, a transplant recipient, and most importantly, my good friend. It was then when Paul Conway and myself came together and we established the national strategy for AAKP, which we implement through 2 national centers. The first center is the Center for Patient Engagement and Advocacy, and the second center is the Center for Patient Research and Education. We work in full collaboration with our many national allies, investors, private sector companies, where we drive care and innovations and changing the status quo for kidney patients. It is our pleasure to have you join us today. And I'd like to give a special thank you to the many patients who are here with us today, as well as our esteemed lineup of speakers who you will hear from throughout the day. I would like to thank also our 2021 Policy Summit sponsors who have helped make this great event possible. First, our gold sponsors, CareDx Inc., Sanofi Genzyme, Travere Therapeutics, and Baxter. Our silver sponsors, Akiba, Bayer, CSL Behring, Natera, and Otsuka. Next, our bronze sponsors, Ardelyx, Horizon Therapeutics, Novartis, and our support sponsor, who's AstraZeneca. We have a great program today, and we will cover issues such as the COVID-19 vaccine and its implications for transplant recipients. We will discuss enduring kidney patients, ensuring that kidney patients have access to their medications and treatments, negative implication of quality adjusted life years. We will talk about equitable access to genetic testing and other innovations that are on the national horizon. And now I'd like to turn it over to my good friend, Paul Conway, who's going to speak about the purpose of the Policy Summit today. Paul?
Thank you very much, Richard. Richard Knight's been a loyal friend and an avid fighter on behalf of kidney patients here in the United States and across the globe in the battle against kidney diseases. The purpose of our annual Kidney Policy Summit is threefold. First, we seek to educate patients and people of goodwill who work alongside them, such as doctors, researchers, social workers, and innovation leaders, on the key issues in the United States Congress and moving across the executive branch agencies that could impact the future of innovation, kidney disease treatment, and patient consumer choice. The second element is we seek to make certain that patients understand that their voice, the independent voice of kidney patients, is powerful, has an impact, and must be represented at every single juncture of policy and in the decisions that are made. It needs to be at the table, not simply listened to, in order to make certain that patients today and tomorrow have timely treatments and innovation. The patient voice must be represented. And the third element is we work actively to remind patients and the people that work alongside them that they are part of a large constituency in the United States public policy process. And what does that mean? It means that 40 million Americans have kidney diseases, and millions more are in families that take care of them. They're among colleagues that work with them. They're in the medical community, and they're in the innovation community and scientific communities. What we're trying to do is make certain that this constituency views themselves as kidney voters, meaning Their voice matters and their vote matters in the public policy process. In 2018, AAKP organized the first kidney voter registration drive that had ever been done in the kidney community. It is now the largest. By 2024, AAKP will have registered 500,000 kidney voters. We intend to make a difference in how policy is made in the United States and have a long view towards investments in research and innovation to make certain that the battle against kidney diseases is more than just a talking point. It's actually a center around which people can coalesce, put their energy in, and see a difference in the lives that have been saved and the quality of lives that have been improved. So how do we do this? Apart from educating folks on issues at the Kidney Summit, we work diligently on Capitol Hill with partners like the American Society for Nephrology, like the Renal Physicians Association, like the American Society for Transplant Surgeons and the American Society of Transplantation, making congressional visits, the power of the patient and the doctor working together. We've worked diligently for the past 10 years on joint efforts to make certain that the patient voice is elevated to congressional staff and elected leaders. In just the past 2 years alone, AAKP had set records prior to COVID of over 600 visits on Capitol Hill. We thought COVID-19 would negatively impact those operations, but fortunately for us, by channeling great energy and the enthusiasm of patients and cutting-edge technologies, we were able to keep that number last year, and already this year, we're halfway through breaking the record, and we're quite confident we'll hit over 700 congressional visits in 2021. In 2022, we plan to go even further on that. The reason why this is important is because congressional staff changes over, and they're distracted by a huge number of other priorities. As much as we'd like kidney disease to be the number one priority, in reality it's not. America has many issues that confront it on the international stage and here at home. But what it takes to make certain that kidney disease remains a priority are people like you who are watching and the organized voice of patients and professionals that work with them, brought to bear on each juncture of the decision process and public policy process. AAKP is a leader in this field, and we're a leader because we work closely with our allies to make certain it's done and done right. The second area that we focus on is building an infrastructure of patients. And what do I mean by that? I mean a network of patient ambassadors, people who are leaders in their field on social media, in person, in meeting, in educating people on kidney disease. Our network of patient ambassadors is world class. These are patients like you and me and caregivers and kidney donors, those who have donated an organ out of the generosity and the need to save a life. These are people that every single day work to educate folks, and they work with AAKP to make certain that the independent voice of kidney patients is raised. And now we've launched a global effort of kidney patient ambassadors, because on the global stage, kidney disease has even more dire consequences. In countries that don't have water infrastructure, in countries that don't have other means of assistance for patients like we do in the United States with a guaranteed benefit of dialysis, patients are left to fight for resources and they're left to fight for care, and so many of them die. It's one of the reasons why we're very focused on making certain that the access to treatments is not simply a US issue or a national issue. We're focused on making certain that the innovations that are being brought forward are available to patients across the world so we can save more lives and impact the quality of life globally. We thank you for watching this and for understanding our purpose. We approach this with a genuine gratitude for all of our supporters and a genuine interest in trying to fight kidney diseases. We will work with anyone, anytime, to make certain that patient care choice is protected and that the independent voice of kidney patients is not only heard and respected, but it is involved at the decision table. Because it's one thing to have a voice, it's one thing to have it heard, but it's quite another thing to have a patient voice impact policy decisions. In order to impact a policy decision, your voice must be at the table. And that's one thing that AAKP has become exceedingly great at. We are very good at making certain that your interests as patients are represented across the policy process. So thank you for tuning in. I think what you'll find this year is that we have focused very heavily on identifying opportunities and challenges to bring in new innovations to you, the patient. We have leaders from some of the largest companies in the world and from some startup companies that are working on unique innovations that are promising and optimistic. And it's part of the reason why we dedicated this year's summit to our good friend Brian Hess. Because Brian Hess was a humble person, I think he would be embarrassed if he knew that we were dedicating a policy summit to him. Because as a humble person, the only thing he was interested in was making certain that patients like him and others who had not been diagnosed didn't have to suffer. He was a noble person, and he was a good soul. And the reason why we dedicate this is because people like Brian are out there every single day working hard. And in their minds, what they're doing is they're simply carrying the torch that patients before them had carried. And they're looking to pass that torch on to others who will join the battle against kidney diseases. Because hopefully someday we'll be at that point where it doesn't impact that many people. But the people like Brian Hess must be remembered because their lives matter and their impact matters. And you, the kidney patient, have the power and the ability to make certain that policy decisions that are made guarantee your ability to be treated in a timely manner and with the best types of innovations that are available. So that's the purpose of the Policy Summit. It's quite direct, it's very lean, and we intend to make certain you have the knowledge you need to be effective. So thank you very much for tuning in, and we hope you like the program.